Hi class, welcome to Social Problems, Chapter 7, Health and Medical Care. Healthcare is a very important issue in our society, and there are many issues that intersect with health on a public scale. There are a number of questions that we need to ask ourselves about healthcare. Is healthcare a right? Is it a privilege? Is there any basis in our Constitution or the preamble to the Constitution regarding health care that should provide a legal and policy basis for ensuring the health of our population? So we will deal with a number of those questions in this particular chapter. What are the consequences for health, whether it is a right or a privilege? One of the things we note in the preamble to the Constitution is to promote the general welfare. And when we say welfare, what do we mean by that? Usually we think about food stamps and aid to families with dependent children, subsidized housing, living in low-income housing based on your income, things like that. But social welfare is much broader than that. It is a right of citizens. It is the responsibility of government to ensure the general welfare of its population. Does this statement include health care? And it's something that we should consider when we talk about health care in society and what is the role of government and whether or not health care is a right or a privilege. Our Declaration of Independence does state that we're all created equal, we're given certain unalienable rights that are endowed by our Creator, rights that cannot be taken away, rights that were not given by man, that we all share in this society. But does this include health care? Do we have a right to health care? And should we have equal access to affordable health care? These are issues that have been debated for centuries in this country, and in recent decades has become more of an issue given the Patients Protection and Affordable Health Care Act. Oh, you're not familiar with this? Oh, Obamacare, that's what it's called. And what are the consequences for policies like this on society and for people with respect to their health? Healthcare is inherently commercial. We live in a capitalist society. It is inherently political. There are those who have a political interest in supporting pharmaceutical companies, the research, the development, the marketing, the distribution of pharmaceutical drugs. We have those who support the interests of doctors and hospitals like the American Medical Association that support political campaigns, that support political parties. So what are the conservative politics when it comes to healthcare? From a conservative point of view, healthcare is an individual responsibility. The government has no role when it comes to the health of the public. And so from that standpoint, that every individual should be able to purchase their own health care and are responsible for their own health. And there is some basis to this. We all have the power in terms of controlling our lifestyle, ensuring that we have regular checkups. Our children have immunizations. So there is an individual side to health care that no one can deny. On the liberal side, however, it is believed that the health care of our population is a collective responsibility, that we all have a responsibility to ensure affordable health care and quality health care in our society. And that is the role of the government and the responsibility of government to ensure that health care does in fact exist. There have been a number of changes in the health of our population since the late 19th century and early 20th century. We are now living longer. The average life expectancy today is 78.7 years. that is since 2015. So we are living longer on the average. Now we could break those demographics down and we'll see that it's significantly different for women versus men. Women tend to live longer than men. We can break this down in terms of race, that whites tend to live longer than blacks. And we can even break the category of whites down. Whites who are vegetarians tend to live longer than whites that are omnivores or meat eaters. So there are a lot of ways that we can look at this. That has not always been the case. Women have not always lived longer than men. In fact, historically, women live significantly less than men. A number of women would die primarily giving childbirth. There were high birth rates. Women would have children at a much earlier age than is typical today. It wasn't uncommon a young girl, 14, 15 years old, being married and beginning to have children, and would have, a large number of children in the course of her life. And that has an effect upon a woman's long-term health. The state of health care at that time was very limited, that if there were any complications, that women would actually die during the process of childbirth. There was also a high infant mortality rate, given the state of health prior to the late 19th century and early 20th century. So there have been a number of changes in terms of our general and overall health. Not only are we living longer, we are dying longer. Historically, we have died of infectious contagious diseases. Life expectancy was low. A person would contract an infectious contagious disease like influenza, pneumonia, and would die in a matter of weeks. It was a very short lifespan and a short period of decline leading to death. Today, however, we are living longer, significantly longer, but we're more likely to die of degenerative diseases that can take years and even decades for a person to die, like heart disease, like cancer, AIDS. These diseases contribute to, are more significant today in terms of our mortality. So we are living longer, but we are dying longer. And the question arises, what's more important? Is it longevity or is it the quality of life? Certainly we would like to have both, but it seems to be that we are living longer, but probably with a lower level of quality of life. And today we're living longer with a lower level quality of life. But historically we lived shorter period of time, but we had a higher quality of life in the life course. In a capitalist society, healthcare is not free. Healthcare costs are increasing with every decade. Many citizens cannot afford health insurance, so therefore people who are members of the underclass and who are among the impoverished are more likely to go to an emergency room, sometimes for very minor illnesses, but the cost in an emergency room is significantly more than a visit to a private physician. Those who are a member of the underclass and uninsured are also more likely to wait until their illness is more serious before they seek medical attention. That also adds to the cost of health care. And where does that cost go? It goes to those who are insured. It goes to those who do pay for their health care, and therefore we have a health care crisis. One of the reasons why a lot of poor people go to the emergency rooms, however, is that by law, emergency rooms cannot deny you treatment independent of your ability to pay. That's not true for private physicians. It's not true for health insurance companies. But for hospitals, they must provide what's known as a standard of care in an emergency room despite your ability to pay. So we have a healthcare crisis that is class-based, and it has a significant influence upon individuals and upon societies. Corporations have a significant influence upon healthcare in society as well. Insurance companies, health management companies like HMOs and PPOs. Today, many of the medical decisions regarding testing, treatment, medications are not made by doctors and patients, but are made by health maintenance organizations. These corporations decide, particularly if you are part of a group plan, and a group plan where the goal is to reduce the cost of health care. So it is the role of the health management organizations to find the most affordable medical treatment, testing, and medications. And so this takes it out of the hands of doctors and their patients. And so we have deferred much of these decisions to people who are in fact non-medical, medically trained people. And they are companies that help manage healthcare and attempt to make it less expensive and more affordable for those who are part of group plans. We have had a number of technological advances in our society as well in terms of the testing and the diagnosis of disease. X-ray machines were a revolutionary technology in the late 19th century and in the 20th century. Today we have CT scans that are more resolute. You're able to see, has a higher resolution than that of X-rays. And we also have what's known as MRIs, or magnetic fields, and radio frequency pulses that are used to produce images of diseases in the body. We've also had advances in surgical techniques and procedures, laparoscopic surgeries that are less invasive, where they will stick sort of a pinhole in the sides of the body cavity and are able to perform surgeries in that way. There is laser surgery. Many of you may be familiar with LASIK surgery, where you could actually conduct a surgery on the eye that is very precise and today has become virtually a routine. There are also robotic surgeries today, that there are robotic machines that are able to perform some surgeries. It's important to understand all of these advances, but also to understand the consequences of using these types of advances in medical testing and treatment. We live in a society that is inundated with synthetic drugs. Young children are introduced to drugs at a very early age for things such as ADHD. Adults take drugs for ailments like hypertension, diabetes, and high cholesterol. And all of these synthetic drugs have side effects. And we are told that because of the side effects, that we will more likely be dependent upon drugs to deal with the side effects of the synthetic drugs in the future. There are also a lot of traditional medicines that are in the world today as well. Some are herbal medicines, some are traditional medicines that are used around the world, places like Asia and Africa and India, places that use these traditional drugs. Athletes are introduced to narcotic drugs. An athlete receives an injury, they are taking a narcotic drug for pain, and it is the case that some will develop a dependency upon these narcotic drugs in the future. The pharmaceutical drug industry is a multi-billion-dollar industry. In 2003, it was documented that the industry was worth about $216 billion. And so there was a peak period where pharmaceutical drugs were on the rise in terms of their costs and was big business. Class has a very significant influence upon health care. Children in poverty are less likely to be immunized, to receive immunizations for chickenpox, mumps, measles, and all of the other childhood diseases. They tend to live in areas where there are higher rates of illness. Families with higher incomes, on the other hand, are more likely to have regular medical checkups, dental checkups, compared to those in poverty. So there is a class inequality in terms of the ability of families in poverty as opposed to middle class, working class, and upper middle class families when it comes to health care services. There is a significant relationship between class and health care in society. You could say that we have the best health care that money can buy, but you must have the money to purchase it. It is less affordable for families with low incomes, and it is more accessible to those of higher incomes. Race is also a very significant factor when it comes to diseases. There is a racial bias. Our textbook talks about this racial bias in terms of the delivery of healthcare services. For this reason, racial minorities like blacks have a lower life expectancy than whites, and people of color have an experience that physicians are ill prepared to deal with unique diseases that are unique to individuals of color. For example, sickle cell anemia is a blood disease that is typically found among Black Americans, and many doctors are not able to accurately diagnose these diseases or to recommend treatments and refer these individuals to specialists. And so there is a racial bias in terms of how healthcare is delivered in society. The textbook also talks about how there's an inequality when it comes to sex. Though women have a higher life expectancy than men, women are less likely to be properly diagnosed, to be recommended the appropriate treatments in our medical profession, in the medical profession today. Women receive more regular checkups. Women are more likely to seek medical attention. Women are more likely to be diagnosed with mental illness compared with men. And male physicians are often condescending and less informative to female patients. A lot of our research is conducted upon males rather than females, and part of that is due to the fact that there is an ethical dilemma about conducting research on women who may be pregnant, who are pregnant, or who will be pregnant. And so a lot of the research is conducted on men, and less is conducted on things like breast cancer, and we tend to spend more on things like prostate cancer that's found in men. Healthcare policy is very significant in addressing the issue of healthcare in society. The Patients Protection and Affordable Health Care Act of 2010 was signed into law by President Barack Obama. It mandates affordable health care for all citizens. And I've listed in the slides just a few of the measures of this particular Health Care Act. One, and these all are unprecedented. These are things that did not exist prior to this policy. First of all, patients cannot be denied coverage due to pre-existing illnesses. All 50 states must have health insurance exchanges. That means they should have a market where they have competing health care options. You can't have one insurance company that has a monopoly over another without any alternative health care. So this is a way to control the cost of health care. When one or a very small group of insurance companies have a monopoly, then therefore they can control the price of health care. There are restrictions on health insurance premiums by age. You just can't charge anything for health care premiums for young people in particular. Individuals are required to purchase health insurance or pay a fine. This is one that a lot of people are very critical of, but it's not any different in some ways from having liability insurance on your car, that you have insurance on yourself. This is a requirement that's part of the Affordable Health Care Act. Employers with employees over 50 in number must provide health care insurance for their employees or pay a fine. The rationale is that sick people can't work, and if people do not have adequate health care, they're more likely to be sick, they're more likely to be off from work. So there are some very noble measures to this Patients Protected and Affordable Health Care Act. At the same time, there are some pros and cons to this policy, like all policy. And we should ask some very critical questions about the Patients Protection and Affordable Health Care Act. Mitt Romney, who was an opponent of this plan, is the one to first come up with the name Obamacare, and that's what it was called. He was governor of Massachusetts, and ironically, in the state of Massachusetts, they have the exact same plan, medical health care plan, as being proposed in the Affordable Health Care Act. However, he was for the plan in Massachusetts, but against the plan for the nation. It is also the same plan, or a very similar plan, to those in Congress. They have healthcare exchanges. They're able to shop for healthcare, and there is competition among insurance companies for our U.S. congressmen. But many of the congressmen were opposed to this bill when it came to the general public, that it would be available to all. What are the pros? This bill, in fact, significantly reduce the percentage of people who were uninsured. Some estimates are around 20 million people who were uninsured were then able for the first time to purchase insurance. Some with pre-existing illnesses. If you have a pre-existing illness, you are previous to this policy, you are not able to purchase health care. So what are the downsides of this policy? It increases the deficit. Someone has to pay for it. It is a big burden on some small businesses because they're required to provide insurance for their employees. And there's an undue burden on rural hospitals that tend to have more of a strain in terms of meeting the demands of the Affordable Health Care Act. Much of the opposition to the Affordable Health Care Act has been more on the conservative side, political side, that conservatives argue for smaller government. The Affordable Health Care Act increases bureaucracy. And conservatives also argue for individual responsibility. That it is not the role of the government to insure everyone, like in socialist countries where you have sort of a nationalized health care, that everyone has a right to health care rather than health care being a privilege for those that are able to afford services and to afford health care insurance. Sociology provides a unique contribution to our understanding of healthcare and the problem of healthcare in society. In the large society, healthcare primarily revolves around physical well-being. Okay, that if you are physically well, then you're well. There's also a acknowledgement of mental care, mental well-being, in the case of mental health in society, dealing with problems like depression and stress and other psychological problems and issues in society. Sociology, however, looks at healthcare in a more comprehensive way. Sociologists define healthcare as more than the absence of disease. It's more than just not being sick. But healthcare has to do with the total physical, mental, and social well-being. So it's not just the body, it's not just the physical side, it's not just mental health, it is also social health, and it is all of these combined that constitutes a person's health. And if you think about it, it makes a lot of sense, because a person can be physically well but have mental illness, and it can become psychosomatic. Psycho meaning the mind, somatic meaning the body. So a person needs, in order to be healthy, needs to be both physically, emotionally, mentally, and socially healthy. The critical power conflict perspective, which we use in this textbook and in this course, contributes to our understanding of healthcare in society. One of the assumptions of the critical power conflict perspective on health is that healthcare policy favors the interests of those who are wealthy in society. It supports the interests of corporations like pharmaceutical companies, institutes that are involved in the research and development of pharmaceutical drugs, the American Medical Association that serves the interests of doctors and hospitals and not patients. So from this perspective, it is very critical of the bias toward those who are wealthy and corporations when it comes to healthcare as opposed to the general public. This policy also argues that racial minorities and the underclass are highly underserved by the present system of healthcare. If they are unable to afford healthcare insurance or to afford services, they're given inadequate services in terms of hospitals and clinics in our society. Political parties and candidates are pressured by the American Medical Association and by pharmaceutical drug companies to provide policies that ensure their bottom lines, that they're able to maximize their profits, minimize costs, and also to deregulate these corporations so they're able to push their drugs through through regulations in government. So the critical power conflict perspective helps us understand how that the healthcare delivery system that we presently have has its biases. It has its economic biases, it has its racial biases, and it has its class biases. And it has consequences for individuals, for families, and the larger society. Let me know if you have any questions.